you are tweeting, please do share your thoughts and your any insights you think are really useful from the webinar, and if you can use the hashtag Simon Talks. Okay, so with that, I'll just give you, I'm going to hand over to Nicholas Pleace. Nicholas is the Director of the Centre for Housing Policy and at the University Research Theme Champion for Justice and Equality at the University of York. He has worked in the field of academia and policy-focused homelessness research for 30 years. He is presenting work led by Dr Joanne Bretherton from the University of York, on which he collaborated on women's experiences of homelessness in the UK, and also referencing the wider European experience of women in homelessness. And with that, I'll hand over to you, Nicholas.
So, good morning. Thanks for coming today. I suppose the first thing I should say is that I should be Joanne Bretherton, because this is work led by Dr Joanne Bretherton, my colleague at the University of York. I'm drawing on three things. The reason I'm presenting today is that Joe's unfortunately teaching this morning and is double booked and couldn't make this time slot. So I did work with her on most of these things, but I'm really presenting work that she led. So just to be quite clear about that. So we're drawing on three things mainly. A project we just completed for Fulfilling Lives, Islington and Camden, which looked at women's homelessness strategy in a London borough. Another thing which we've done recently, which is an evaluation of the Domestic Abuse Housing Alliance, or DAHA, accreditation system, which is about domestic abuse and homelessness prevention, among other things. And finally, the evidence review, which Joanne did with Paula Mayock at Trinity College in Dublin, which I wasn't involved with, but which looked at the kind of state of knowledge on women's homelessness in Europe. So the background to this is, while I'm coming at things from a UK and to some extent a European perspective, the background to this is actually Irish, in the sense that a lot of the most important work that's been done in the last 10, 15 years has involved Dr Paula Mayock, Dr Sarah Sheridan, who's here, and Dr Sarah Parker, among others, who are all currently or previously at Trinity College in Dublin, as well as having other roles in the Irish homeless sector and so on. And their works explored experiences of homelessness in new ways, women's experiences of homelessness in new ways across multiple projects. The first time I became aware of their work was back in 2012, when I was invited to come and respond to the report on women's journeys through homelessness, which was a sort of biographical exploration of women's homelessness in Ireland. That led to various discussions, which eventually resulted in what was called the Women's Homelessness in Europe Network, or WEN for short, the main product of which to date has been an edited collection of academic articles from across Europe involving many different authors, which was published in 2016, which is Women's Homelessness in Europe. So Fulfilling Lives Islington and Camden, they're an NGO funded through National Lottery and other resources that focuses on multiple and complex needs. This project focused specifically on women experiencing homelessness with high and complex needs. So increasingly across the UK, there's more and more evidence of the presence of, and as I put on the slide, forgive the terminology, but people in revolving door or frequent flyer situations with high and complex needs. So they're constantly in the system or in and out of homelessness systems, but their homelessness doesn't tend to be resolved. They're kind of stuck in patterns where homelessness is sustained or recurrent. a small population, the evidence suggests, but at least 1/3 are women. That's the evidence we've got in terms of the UK. And they're a very high cost, high risk population. High cost in a financial sense, but also kind of high human cost. And they're a population who experience extreme forms of risk and trauma. The other thing, which came also from the work that had been done earlier in Ireland, was that there seemed to be more and more evidence that women experiencing homelessness with very high needs on a sustained and repeat basis we're quite often doing that as an experience of hidden homelessness. So sofa surfing, staying with friends, acquaintances and relatives, rather than having contact with services. The goal of the research was to develop a new integrated strategy for the area covered by the London Borough of Camden. So London government's extremely complicated. There are 32 local authorities, there's an assembly, there's a mayor, and there's the City of London, which is this sort of medieval guild, partly elected authority that's got its own police force. The broad context for London is that nobody's really entirely in charge of anything when it comes to responses to homelessness. There's kind of power and resources and strategic responsibility are quite scattered across multiple elected authorities. So we were focusing on Camden, which is right in the centre of London, and that's about 260,000 people out of pushing 9 million within Greater London as a whole. What we found when we looked at what was happening in Camden was that there was an understanding already that there was a population of people with high and complex needs stuck in patterns of repeat and sustained homelessness, and that a growing proportion of this population were women. The work that we did in Camden suggested that the actual number of women was higher than what was being estimated. So there was the kind of idea that it was 1/3 of the population, up to 1/3 of the population of people with high and complex needs experiencing recurrent and long-term homelessness. It looked like that proportion was actually bigger, and it was kind of more 40-60 or possibly 50-50 in terms of what the mix was. When we did a survey in Camden, we found 134 women experiencing homelessness. This was in the late summer of last year. 23% of those women had slept rough the night before, and 74% reported that they'd been homeless more than once. The other thing that we did for this research is 59 women agreed to have their records of service use across the area shared anonymously with us. So all identifying markers were removed before the data was shared with us at the university. So we had nothing like their name, birthday, exact age, or the names of the services or their locations or anything about medical records or anything like that. But we did have a kind of broad pen portrait of their experiences and needs within that anonymised data. 1/5 of them had contact with child protection services, so had been looked after children with social work involvement, sometimes that would have involved fostering, sometimes it would have meant removal from the family home and placement into care. 1/5 of the women that reported those experiences. Half had reported experience of sexual violence, and 3/4 reported experience of trauma. And there were also high levels of self-reported addiction. We didn't have great data on mental health, but anecdotally there were suggestions of combinations of addictions and severe mental illness being quite widespread amongst this group of women. Another characteristic was across the piece, we found that lone adult women were often parents who had had one or more children taken into care, or had also placed their own children into other arrangements when they'd become homeless. So they perhaps put their own kid with the kid's grandparents because of what was happening to them and because of what was happening around homelessness. So a lot of them were parents, even though they didn't have dependent children with them. We also talked to small groups of women alongside this. It was difficult to do. Our original plan was that Joanne would be there face to face and we'd be talking to women about their experiences, but we had to do it remotely because of the COVID restrictions. So we used a mixture of remote methodologies to do that, which wasn't ideal, but we were able to get some stuff together on it. Women had often just survived one terrible experience after another on a sustained and repeated basis. Just one of those sets of horrible traumatic experiences was the experience or the multiple experience of homelessness. Their lives were really characterized by becoming stuck, falling out of services or being unable to reach services. So they were constantly in a position where they couldn't move on from services, move on in a broad sense, from services they were using into different circumstances. They sometimes fell out of services because there were issues within those services, or they couldn't get access to things. They were constantly falling between the gaps in provision. The right packages of support, care, treatment, suitable and sustainable and affordable housing, which in London really only means social housing, which is under extreme pressure, it was often not available to women. So when we talk about women with complex needs and homelessness, we quite often use North America and another language around things like chronic, repeat and high and complex needs, which emphasize the characteristics of the women experiencing homelessness. But the issues that we were finding in Camden seemed to centre on systems, not on the characteristics and choices and agency of the women. Not that those things aren't important in terms of understanding and responding to their homelessness, but the explanation of continued and recurrent homelessness seemed to centre on a lack of an integrated strategic response to women's homelessness. Now, it's important to see the broader context in the UK. So UK homelessness laws, which now exist in different forms in different administrative areas, national and provincial government. So they're not the same in Scotland, Wales and Northern Ireland as they are in England, but they all contain provision dating back to the original 1977 homelessness legislation, which was that women and women with dependent children who were at risk of homelessness because of domestic abuse should be prioritised in terms of access to alternative housing if they became homeless. In 1977, that meant priority access to what was a very large social housing stock in the UK. It was roughly a third of all housing in the UK was council stock or social housing in the late 70s. This was much diluted by this point in time. So there's now only a duty to temporarily accommodate until settled housing, which is quite often in the private rented sector, is in place. And the other thing is that the systems have become much more preventative rather than reactive. So that's a shift. Something I've not got on the slide, which looks like it's going to be important, is the new domestic abuse legislation, which was passed last year in England, has re-emphasised the prioritisation of women and other people at risk of domestic abuse in terms of homelessness systems and services, and that seems to be making a difference. There seem to be more people, largely women, at risk of domestic abuse being accepted and responded to as homeless because of that legislation on domestic abuse that passed last year. The other bit of the context is that the homelessness systems in London are totally overwhelmed. So at any one point in London, there's around 70,000 households, a lot of which are families in temporary accommodation. Temporary accommodation is what in Ireland you'd call emergency accommodation quite often. So it's not so much hotels and bed and breakfast type responses because that's been moved away from, but there's a lot of apartment hotels, there's a lot of very short-term lease, private rented sector accommodation within secure tenancies. As I said, the great bulk of that 70,000 is homeless families. that terminology conceals to some extent who those homeless families are, which is that a high proportion, by a very clear majority of those, are lone women parents with dependent children with them. And quite often, although not universally, domestic abuse has been one of the factors in the causation of their homelessness. So 70-odd thousand households containing about 100,000 children. Expenditure on temporary accommodation in London is gigantic. So in 2017, it was equivalent to some 760 million euros over the course of one financial year, one calendar year, sorry. It does mean that mother and child street homelessness and shelter supported accommodation homelessness in the UK is quite unusual compared to some other countries around the world. So many of the women in Camden, going back to the Fulfilling Lives work, were experiencing this repeated and sustained homelessness, but associated with complex needs, but they couldn't get access to assistance under the homelessness laws. They were either not eligible, or effectively the kind of waiting list, the capacity of those systems to respond was too limited. There's enormous pressure on local authorities that administer the homelessness legislation in London, which leads to very strict interpretation. Demonstrating clear evidence of current threats and risks from domestic abuse is necessary. You have to also, if you've got dependent children, demonstrate that you've got dependent children with you, which is another way that you can get assistance. It's much easier to demonstrate whether or not you've got a kid with you than whether or not you're facing a tangible, meaningful threat that means you should be assisted under the legislation. As I've said, the most recent domestic abuse law passed in England seems to be improving that and is requiring essentially a kind of lower standard of proof. None of the legal frameworks and a lot of the homelessness systems do not protect migrant women. Anybody without settled status, without leave to remain in the UK, can't access those services. Within Camden, there was only a very small group of women in this category that we found in terms of the research on in Camden, but they were still there. They weren't very numerous, but they were still there, and they couldn't really access anything. London's quite a service-rich environment. That's in the context of across all of England, about 1.2 billion in funding being removed from homelessness services since 2010. Most homelessness services are commissioned by local authorities, but even though there's been very significant budget cuts in the homelessness sector in England particularly, London, compared to much of Europe and the rest of the world, is still a very service-rich environment in terms of homelessness services. But another thing we found from the Camden work and that other researchers pointed out is that a lot of those services are built around an image of what lone adult homelessness is. And that image still centers on the idea that lone adult homelessness is disproportionately experienced by lone adult men. Now, Joanne and Paula Mayock talk about spatial, administrative and methodological flaws in data collection in the evidence review they did for Fienza last year. So the spatial error in terms of counting women and counting women's experience of homelessness is that quite often survey methodologies look in places where women are not likely to be visible or not likely to be present in high numbers, and that's because those spaces are unsafe or male dominated. So if women find themselves in a position where they have to sleep rough, they will tend to hide. I mean, it's not something that's exclusive to women. Lots of people that would feel vulnerable and would not necessarily sleep in a place where they would be seen. And women would, for very understandable reasons, want to avoid male-dominated emergency shelter and support services. Administrative errors, the key one there is that not just in the UK, but in many European countries, if you are a woman and you get assisted by refuge services or other domestic abuse services in whatever form they exist, you get counted as somebody who's experienced domestic abuse, and your experience of homelessness doesn't get logged administratively, which creates an instant undercount in terms of what the experience of homelessness is. And then finally, there's a methodological flaw, which is that existing systems of enumeration aren't good at counting hidden homelessness. And there's more and more evidence that hidden homelessness is disproportionately experienced by women. That's because counting people who are sofa surfing is much harder than counting who's using a shelter or doing a street count, even though street counts are inaccurate. A recent pan-European cost action called Measuring Homelessness in Europe found the same issues as were reported by Joanne and Paula in their work. What I've just said there, yeah, these things about why they hide. So is London really a service-rich environment when it comes to homeless women? And the answer actually is no, especially in relation to women with complex needs. And part of the reason for that is the scale, nature of the problem of women's homelessness associated with complex needs just wasn't realised, and it wasn't thought about because it was thought to be a kind of marginal or non-issue because the data didn't seem to suggest that it was there, whereas it actually is there. So just to finish off the last few slides, really, amongst the most important findings with Fulfilling Lives work and other research around women's homelessness is that while domestic abuse is not the sole cause nor an experience that's universal among women experiencing homelessness, it is extremely prevalent. It's near universal when it comes to women with high and complex needs. One thing that flows from that is the domestic abuse and homelessness services have to be integrated to a much higher degree if you're going to have an effective strategic response to women's homelessness. Just briefly refer to the DAHA work, so the Domestic Abuse Housing Alliance work. This centres on the idea of an early warning system for domestic abuse, which is used by which centres around training housing provider staff. So someone comes to do a repair, they've got training to help recognise if there might be a domestic abuse issue, and that's why the repair is needed. Or if there's a rent arrears issue, they've got training where they can look at whether or not that's financial, psychological abuse that's happening in terms of why the rent's not being paid. And DAHA accreditation supports housing providers in implementing this approach. And it's first employed by a major social landlord in London, Peabody, led by Goody Burnett, who now heads up DAHA and other things. And that found, when that was implemented, it found a huge increase in reports of domestic abuse compared to the systems that have been there earlier on. I'll also briefly just note the work that both Joanne and my colleague Deborah Kilgore have just been doing on Threshold Housing First in Manchester, which was a 5-year pilot model in the end that looked at Housing First for Women. That found that Housing First for Women had to follow a different model. It had to be built by and run by women in order to work. But safeguarding and protection against ex-partners and other abusers were major concerns. Whereas Housing First for Men was often dealing with the absence of any kind of relationships. With women, it was often dealing with men whom the women had left because of domestic abuse and the management of that risk. So safeguarding had to be baked into Housing First in a way that's not talked about when you talk about what a high fidelity Housing First service looks like or how it should work. There were real differences in terms of the pattern and nature of need amongst women who had high and complex needs and who were experiencing homelessness. So really this boils down to moving beyond two stereotypes that both look to be wrong. The first is the lone adult homelessness is disproportionately experienced by men. And again, there's these spatial, administrative and methodological flaws that have happened around why we've undercounted and missed the extent of women's homelessness. a major one, which is failing to account for women's experience of hidden homelessness, which goes back to the work that Paula and Sarah Sheridan did back in 2012 around the biographies of homeless women in Ireland, which found that. And the other sort of myth that we need to move away from is that when women become homelessness, they tend to experience lone parent homelessness. And the fact that they're lone parents with dependent children with them means that various welfare, social protection, child protection systems protect the women from homelessness because they're there to protect the children from homelessness. That's not just a UK thing, and neither's the lone adult male thing. These are kind of pan-European assumptions in terms of policy responses. And that second one around women are likely to become homeless with their children and therefore be protected by the systems that protect children, that doesn't take into account children being taken into care or placed into care of others by their mother. So we came up with a London strategy, which I won't go through because it's got loads of London stuff in it, which is just not relevant to Ireland, but we drew a picture of it, so there it is. The key points from that were a need for, well, broader points from that, which I think might have applicability to Irish and other European responses, which are the need for shared protocols around data, around processes for referral, the need for unified joint assessment, including health, mental health, addiction, social services, which is now called social care in the UK, children's and family services, the homelessness sector itself, so social housing, and criminal justice and domestic abuse services. The kind of, some of this stuff is very standard around what we do about homelessness in general, but, you know, prevention and rapid rehousing wherever possible. Services need to be built and run by women when homelessness occurs or cannot be avoided. You need a mixed range of provision to reflect different kinds of needs amongst women. Housing-led and housing-first services are part of a mix. In Ireland as well as in somewhere like London, I know there's similar pressures in Dublin. You know, sustained deep undersupply of adequate affordable housing is a constant background issue and challenge around how to implement this. So thanks very much for listening. Again, to reiterate, this should be Joanne talking rather than me, because she was the lead on all these projects, and just to acknowledge the support of Fulfilling Lives in Islington and Camden, DAHA, Fienza, and also Threshold Jigsaw Housing in Manchester. Thanks very much.
Thanks very much for that, Nicholas. I have lots of questions already. That was really informative, and I think that asks a lot of questions. There was some of which we answered, but not all. But I'm not going to abuse my role as chair. I'm going to hand over to the person I asked here to respond, which is Dr. Sarah Sheridan, who's an independent researcher with a particular interest in homelessness, gender equality, and applied social research methods. She's co-authored, as Nicholas has referenced, several reports, articles, and book chapters on the topics of women's homelessness in Ireland. She works as a researcher on a biographical study of women's homelessness in Ireland, led by Paula Mayock, and her doctoral thesis was a longitudinal qualitative study of women's homelessness. Previously, Sarah worked in research-minded roles in the Irish Human Rights and Equality Commission and with our colleagues in Focus Ireland, where Sarah and I were colleagues together. Okay, so I'm handing over to you, Sarah.
Thanks very much, Wayne. And thanks to Simon Communities for inviting me to speak here today. And thanks to Nicholas for presenting on, and to Joe as well for their excellent study, which I thought was just really thought-provoking and also very important. And I think it really shines a spotlight on a subgroup of the population, long-term homeless women, who I would argue to be perhaps the most overlooked and misunderstood subgroups of the homeless population. And I think obviously we know homeless population is already a disadvantaged group, but I think this provides us, this report that Nicholas has presented here today, provides us with an opportunity to return to this really important issue. So my response today, I'm just shaping it around three kind of key pillars. The first is I just want to tease a little bit more out why women might why these women might be particularly overlooked and misunderstood, a lot of which Nicholas has already touched upon. And then I'll just draw some parallels from Nicholas's research with a study I was involved in that's been discussed and referenced a number of times, but to draw out some of the parallels that are occurring in the Irish context, with a specific focus on this cohort of long-term homeless women. And finally, I'll just discuss some of the strategic policy responses we might consider from drawing on all of these reflections. So first of all, why long-term homeless women might be overlooked and misunderstood. As the study references, there are stereotypes and negative framing of these women who are long-term homeless. Nicholas referenced already these spatial, administrative and methodological flaws that might not be capturing their experiences. And they're ultimately seen to deviate from kind of deep-rooted cultural norms around women and their role as homemaker, as mother. And they're often assumed to make perhaps poor decisions, which has directly caused their homelessness and personal problems. And the many systemic failures that have occurred across their life course, therefore, is not fully understood. And these deep-rooted assumptions can also permeate our understanding of the problem and permeate our approach to policymaking. They can arguably shape various categories of need when it comes to housing allocation or supports. And it may determine who is deserving and who is undeserving of housing and supports. And I'll return to this issue later. Even when, I suppose, new innovations and service provisions like Housing First that Nicholas referenced are invested in and rolled out, this is often tailored to the needs of male rough sleepers. And even though Housing First is expanding rapidly across Europe, discussions on how these might be applied to the needs of women remains at a relatively early stage. Certainly from an Irish perspective, Nicholas referenced that there's some advances in the UK, which is really important. The policy priorities and media representations of homelessness are more likely to focus on different types of homelessness. So we're all very aware of the rise of family homelessness in recent years. And similar attention is also afforded to those who are roofless or rough sleeping, who are by and large male. So that's not to say that family homelessness and rough sleeping don't merit our attention. Of course they do, but we have to be cognizant of the subgroups of the population that are consistently overlooked and consistently left behind. And that's why, as I say, it's really great to have this opportunity today to talk about these women who are essentially, languishing in hostels and sometimes moving between emergency accommodation and institutional spaces for years and years on end. So it's already been referenced before, but I'll just give a brief background on the research I was involved with some time ago. So in 2009 to 2011, I was researcher on a biographical study of women's homelessness led by Dr Paula Mayock in Trinity College. And this study was essentially 60 life history interviews with women in homeless services in Dublin, Cork and Galway. And we also carried out ethnographic observation across service sites. In 2011, I began a PhD under Paula's supervision, and this doctoral study was essentially a longitudinal dimension, built a longitudinal dimension onto the previous study. So my goal was to, follow up with and re-interview as many of the 60 women as I could find and ask them directly what had changed in their life, what was the same, and to identify patterns across the cohort, particularly around who had transitioned into housing and who were still homeless by the time I re-interviewed them. So in total, I re-interviewed 40 of the original 60 women. This was between 2 and 3 years after they were first interviewed. And as we know, just as a caveat, women obviously experiencing homelessness are not a homogenous group. They have different backgrounds, different stories. Even within those who are long-term homeless, there's a diverse and intersectional experiences. But there are lots of parallel trends that emerge across the long-term cohort. And so many of these parallels are seen in the UK research that Nicholas has presented this morning. So I'll just spend a couple of minutes teasing some of these out. So firstly, to focus on a concept that really came to light in Nicholas's report, and I think it's really important, and it's the concept of unresolved homelessness. So I find it's a particularly useful term and appropriate for this cohort of women, as it captures these systemic barriers inherent in their lengthy homeless histories and the policy policy and services have yet to find an adequate response to their situations and to ensure that they permanently exit this very harmful existence. So I think it's relevant to just talk about the tracking process of my PhD. So when I set out to track and re-interview the women that I'd interviewed 3 years previously, I'd assumed perhaps that it would be harder to track and find and re-interview this particular cohort of long-term homeless women with high and complex needs due to, I suppose, the chaotic nature of their lives, their complex support needs, etc. But actually it was quite straightforward to track many of them down because, depressingly, they were in the same position they had been in 3 years previously. Their homelessness remained unresolved. So they were circulating between the same handful of hostels and accommodations in Dublin and in other institutional spaces such as prisons and hospitals. So in total, across the sample, of the 40 women I re-interviewed, 18 of these were still homeless at phase 2. And they were far more likely to be the long-term homeless cohort. Their personal situation had rarely improved. Their support needs were more likely to have deteriorated over that time. They reported worsened chronic health conditions. They had often reported some serious mental health issues that had also deteriorated in the intervening time. Many reported multiple hospital transitions, hospital experiences, admissions, should I say. And some of them had, in the absence of formal support structures to support them out into housing, some of them had exited usually for very short periods of time, exited homelessness into rental accommodation, but more typically the kind of lower end of the market, perhaps, access through informal networks, rogue landlords, substandard accommodation. And many described abusive partners, financial difficulties, and ultimately they had returned to homelessness. So their homelessness in all senses of the word remained unresolved. And secondly, and Nicholas really drew this to the fore in his presentation, was that presence of gender-based violence, abuse, sexual assault, rape, that they described across their life course. In the study we carried out in Ireland, 3/4 of the women experienced domestic violence in the family home. Half had experienced child sexual abuse in their childhood, and this abuse often persisted for years on end. And these early experiences of violence and sexual abuse really had a profound effect on women in their life. They talked about post-traumatic stress disorder, drug or alcohol use to numb the pain, recurrent nightmares. And in other words, they had very deep emotional scars that never truly healed around these early traumas. And further, 40 of the 60 women at phase 1 reported that they experienced intimate partner violence at some point during their lives. And what I thought was a staggering 12 of these women had reported violence from more than one partner. And very often they might have been in a couple while in homeless accommodation, and sometimes they reported, service exclusion because of domestic violence, or women following their partner who was excluded from the service. So we're talking about endemic violence and abuse across the life course, and traumas never truly addressed, justice rarely pursued, and these women are often forgotten and as Nicholas said as well, falling through the cracks. Women experience violence regularly. You're at a far greater risk of violence whilst homeless also. And there's a lot of important debate in Ireland just, around the safety of women in public spaces in our society. So, thinking about how women in long-term homeless situations negotiate their risk on a daily basis, not having that protection of a home, which can be, an additional layer of safety to protect women. And many reported, for example, if they were engaged in sex work, violence and rape were constant threats, unwanted sexual encounters in exchange for accommodation. And then, of course, if even in periods of inadequate substandard housing, very often experiences of violence, abuse in those spaces also. And thirdly is just the impact of sexism at a structural level, which I thought really is a an argument strongly made in the UK report. And in the Irish context, just by way of reflection, it's built into our constitution that a woman's place is in the home, and being a woman who is out of home or separated from their children, or children being in care, really bears significant stigma for women in these situations. And society has, broadly regarded that these women have failed to fulfill their role as wife or mother. And the stigma also applies to their children and their family members who may have sporadic or no contact with their family member in a chronic homeless situation. And our research showed that the stigma of being a woman out of home was internalized by women in multiple ways. Many women described feeling, discredited, forgotten, judged by society. This process culminated in a really low self-worth, of feelings of shame and sense of personal responsibility for their situations, depression, hopelessness. And many women described how they lost interest in themselves. One particular woman I remember, who I would have met regularly through ethnographic observation, I could see how she went from being very bubbly extrovert around the time but I first interviewed her, center of the room, quite a kind of a matriarch in the hostel space. The other women really looked up to her. And by the time phase 2, and I'd re-interviewed her, she was extremely isolated, depressed, very, very hopeless. And sadly, after I had interviewed her about a year later, she had passed away due to complications around her chronic illness, only in her late 30s. So you can just see the harmful impact, obviously, that unresolved homelessness has on women. So I'll just try to be as brief as possible, but just how can we apply these learnings through a strategic response? I really like how the report of Jo and Nicholas's draws directly from the insights from the study and applies them to very practical strategic proposals. And I think there's lots of learnings that we can draw from in this regard for the Irish context. So for these long-term homeless women, a home is often just such a far-fetched, elusive, unattainable notion. They're deeply entrenched in the service structure and institutional spaces and depend on these for practical and emotional support really in their lives. And we really need to just focus on routes to housing for these women with appropriate supports that aligns to their needs. Call it housing first for women or something else, but whatever it is, they need to have access to housing. And also what comes through as well in the UK context is just that kind of integrated service provision, and to ensure that trauma-informed duty of care is upheld across these service provisions, from health services, reproductive health, mental health, counselling, support for substance use, but also coordination, as Nicholas referenced, between the domestic violence services and homeless services, focusing on this long-term high needs, complex needs cohort. Prevention is obviously key, prevention against long-term homelessness and prevention against early experiences of homelessness. And one thing I would say, it's really important that we think about this issue through the lens of poverty and socioeconomic disadvantage, because certainly in our research, socioeconomic disadvantage is pervasive across the lives of long-term homeless women who very often grew up in impoverished communities, more likely to report intergenerational poverty, inequality, more likely to disengage from school at a young age and spend intermittent periods out of home as teenagers, or perhaps experiences of care, and early parenthood and housing instability whilst being a new mother was also frequently cited. So this adversity in childhood and adult life places women at a high risk of homelessness at an early age, and crucially impacts their capabilities to resolve their homelessness later in life. And above all, I think we really need to combat negative stereotyping of these women, and considering the concept of unresolved homelessness and putting it center stage. Because framing the solution is important to frame it as a systems solution, as Nicholas referenced. It's structural, it's not individual. We need to understand how trauma and adversities manifest themselves in behavior later in life. And in the case of these women, some of these later experiences can compound trauma. And we must really interrogate categories of need in our social policy or housing allocation, and really interrogating who we consider to be a deserving or undeserving of services, of housing, and making sure that nobody is left behind in that. But just kind of, you know, that simplistic way of thinking about homelessness among women as either deviants or victims. You know, the situation is far more complicated than that, particularly when you adopt a biographical lens. And the very final thing I'll say, I'm sorry if I've gone on a little bit too long, but to inform any strategy, we need to integrate the views and insights of those with lived experience. And I'm here as a researcher today. I've spent time in the field and I've analysed a lot of data, but it's the women in these situations who are experts by experience. And I'm also cognizant that frontline workers have really important insights that around strategies that work and have, you know, a clear view on the gaps in services. So I think these views and insights need to be centre stage for any strategic response to this particular issue. So I'll leave it there. Thank you very much.
Thanks a million, Sarah. That was really comprehensive, and also great to you were able to bring in that which your own research, which Nicholas had referenced. So I think it gives people a real feel for the work that's gone on in this field, because I think it is one of the criticisms that women have been neglected in research, particularly women who don't have their children with them and they're experiencing homelessness. So it's nice to see that Ireland is at the forefront of that in the European context. The questions are now open. So if you want to pop your questions into the chat or into the Q&A, well, I will ask them. But to start off, I think Nicholas and Sarah, we talked about some of the responses, which I suppose is really what we want to unpack a little bit. One of the areas is we're currently developing here, or the Department of Housing is currently developing a strategy around preventing homelessness. You know, it's something we've engaged in, and it's obviously critically important, because if we can prevent someone crossing the threshold of a homeless service or experiencing homelessness, we're preventing a lot of trauma. So I'm just wondering, Nicholas, I thought it was really interesting, the example you drew out about making housing officers aware of how to respond to domestic abuse, because that is such a driver. Are there other examples, or was there other things in a preventative mode that stood out with you? And also taking account of the hidden homelessness, is thinking about, do we need to change the way we think about prevention when we think about women's experience of homelessness?
Yeah, I mean, I suppose the main thing I'd flag was the stuff around much better integration of domestic abuse and homelessness services, so that they don't connect up with each other in a coherent way necessarily in the UK. I mean, it's kind of variable, but they're still administratively, structurally, and to some extent financially separate from one another. The new laws are out. The new law that was passed last year should sort of help enhance some of that stuff. I mean, I'd kind of echo what Sarah was saying though around kind of structural sexism and a kind of, it's not at strategic level, women's homelessness just isn't taken as seriously. Some of that's around images and enumeration and so on, but there's a major cultural mindset issue that goes beyond the need for kind of structural administrative reform around things like that. I mean, in terms of prevention, yeah, I mean, I think DAHA is a very strong model, and the research that Joanne and I did around that just seemed to think that, yeah, this is a better way, because if you can flag the signs of domestic abuse as soon as possible, and you've got multiple ways in which you're doing that, in which you can potentially find out whether or not it's happening. And DAHA's trying to extend it into the private rented sector and so on as well. That's the best thing, because your ideal response should be a perpetrator response. It should be focused on stopping the perpetrator and on maintaining, that it's not the situation it is now, where as a last resort, a woman has to run. that should never be happening in a properly orchestrated preventative system. It should be the perpetrator is the focus, and that perpetrator is managed, and the woman's housing stability, and frequently the housing stability of a woman and her dependent children, is emphasised, and that we're not always in a kind of crisis response to this. I mean, there's a wider point around. Also, we need stuff around mental health. Also, we need stuff around addiction to not be simply reactive. And I think there's kind of parallels with Ireland in that some bits of the system need more integration, but also need more resources in order to function. So I think kind of mental health services and their integration with homelessness is a major issue around across Europe and in the UK. And I think there's, but we also know that, going back to the systemic point, there's kind of gender distortions and misogyny and sexism in those services. I mean, reviews of UK mental health services, you're more likely to get a formal diagnosis if you're a woman on the same criteria. Those kinds of biases within the systems are a wider point as well, I think.
Sarah, do you want to come there as well?
Yeah, like I suppose in terms of early prevention of early entries into homelessness, there's lots of different things that are going on, like just around poverty prevention or supports for young people who are children and young people who are experiencing adversities, and to support them so that they don't enter homelessness in the first place. And so there's definitely a youth homelessness question just when looking at the biographies of these women. But like in terms of prevention of long-term homeless, it's just going back to that question of rapid rehousing as well. And I think like the impact on the women who are just cycling between hostels and services for years on end really does have an impact on their capacity to ever exit homelessness, because the feeling of being personally judged, the feeling of being forgotten about, and that better integration across services, less kind of like I remember, for example, some women who are of the long-term cohort who would experience violence just on a regular basis don't feel that they fit the criteria for domestic violence services. So they're also internalizing these kind of categories of what deserving and undeserving. And I think the impact that has on your sense of self over time can be really profound. So I suppose when I'm thinking about prevention of long-term homelessness, I'm also thinking about ways of working with women and to kind of combat those that stigma that they're internalizing all the time.
I thought as well, thanks for that. I think that they're really useful insights. I think just to continue to draw on that then about thinking more about how we respond in that way. I thought the other interesting example that you brought out, Nicholas, was looking at women's housing first. That there were that juxtaposition of the difference between the male experience of going into housing and women's experiences of going into housing, even though we tend to think about homelessness as you respond with a house with support, but if the structure of that support isn't thought through in the right ways. So I would imagine, I know probably those things happen, they would happen in ad hoc ways in terms of how the supports are put in place. But is there something more systemic, or how did the Manchester experience build an infrastructure that allowed that sort of protection to be in place?
Yeah, I mean, just very quickly, the Manchester one started off kind of quite orthodox, and rapidly adapted itself. I mean, it was designed and run by women from the first, but they had to pivot to a far greater degree than they were expecting as soon as they started having their first cases. And I suppose the reason why that service was effective is that it was running around constantly trying to compensate for the gaps and lack of communication between the more formal structures. So it was kind of acting as multi-directional oil in the administrative and service machines to kind of try and connect things up that weren't connected up, try and flag things that weren't together. I mean, it was successful too because it got itself structurally into a strong position. So it guaranteed, because it was run by a social landlord, a housing association in the UK, it had a guaranteed social housing supply. And it was also developed from the first in coordination with the UK, the Manchester's probation service, and with domestic abuse services in Manchester. So it was kind of built with their involvement from the ground up. So it didn't arrive, and when sometimes stuff goes wrong around housing first, because it kind of arrives out of nowhere as a pilot and it isn't very connected up. So this thing was built with probation, with domestic abuse written in. I mean, one of the characteristics of the women using the Manchester service was that they were all small-scale offenders. And one of the strongest findings of it was that as soon as they got better support and sustainable housing in place, their offending dropped away to nothing. And some of them had been committing small-scale stuff, quite often drug-related, very frequently for years, and it just stopped to a degree that was very surprising, because they just suddenly had the right supports in place. I mean, the other broad point was, in common with how housing first supposed to work, it listened to them and it responded to what they said they needed, rather than kind of giving them a pre-arranged package of support, which, like Sarah was saying, and like worker people like Cecilia Hansen Nostrand in Sweden has said, there's a load of kind of ideological, cultural, sexist baggage that can come attached to welfare, homelessness services when it's presupposed about what the characteristics of the women are. I mean, one of the things that comes up in the UK is this kind of constant raising of an issue that isn't necessarily an issue, which is an expectation that there'll be sex workers, which is only a media construct, and most of them aren't if you talk to them. But the idea that homelessness amongst low women equates to prostitution is a kind of mainstream idea, and you're kind of, even though there's not really any evidence to do that, you're constantly pushing against those kinds of assumptions. And it goes to what Sarah was saying about ideas of deviance, that you're deviant if you're a homeless man, but culturally, if you're a homeless woman, you're more deviant because you're further away from these kind of prescribed, culturally constructed roles, even in countries like the Nordic countries, even there, where it's all supposed to be kind of social democratic, groovy and relaxed, it's not the case. There's still this kind of undercurrent of sexism. And anyway, I think round that is to not have men in the equation, essentially, when you're designing services, strategies and approaches, and to emphasize expertise of the experience of the women.
Sarah, I'm conscious we're now at 11 o'clock, but there was one question from Joan Reinhardt here for both you and Nicholas. So I'm just going to park that one there. I know, Sarah, you probably have a lot to say to what Nicholas has just said. But Joan had asked if either of you had explored the area of women accessing homeless services who have children in care, and how they can be supported with access and being identified as a woman with children over being viewed as a single woman with a housing need perspective. I know you touched on this, Nicholas, but what they're seeing in services is that access with children is being slowly reduced and made more and more challenging, further compounding the trauma of the experience of homelessness. If you just both give us a 1-minute reflection on that, and then, because conscious people need to, we promise people to keep them here at the end. Sarah, you might go first.
Yeah, sure. Just very brief. I think Maeve Savage has done her PhD on this particular issue. You might want to follow up directly with her. Definitely, we opened up our interview saying, what would you like, you know, it was an open-ended question, tell us your life story. And a huge proportion of the women, when they answered, spoke about their children, first of all, even if they hadn't seen their children for a long period of time. So the presence of the experience of being a mother and children being in care was very, very stigmatizing for these women. And they felt that they internalized a lot of shame and trauma around this. So I think if there were ways in which this issue could be addressed, ways in which particularly in a housing first model, that if women were given access to housing, that they have the opportunity to arrange visitation from their children, or maybe transitionary arrangements to connect again with their children. Because I think once women do have the opportunity to reconnect with their children, and if that can be nurtured and fostered in the service system, all the better for everyone involved, I think. So, but as I said, Maeve Savage, I think, has done some research on this.
Yeah, just very quickly. I mean, the major issue in the Housing First Manchester evaluation, almost all the women that were using the Housing First were in that position where they had children taken into care, sometimes associated with homelessness, sometimes associated with criminality, or some kind of combination of the two. It was something that the Housing First service adapted itself to do, to build bridges and to communicate with child protection and social services, and try and negotiate and help women negotiate access to their children. Sometimes that was very difficult. Sometimes the women had lost track of where their children were. So, I mean, if they'd had a child taken away from them by one local authority and were now some distance away in another, kind of knowing what had happened to the kids or where they'd gone could be a very traumatic experience. So some of them were dealing with all the kind of issues of guilt, worry, separation and trauma. But an added one was that if they'd been homeless for some time, and sometimes they'd lost more than one child into care, just finding them was a challenge sometimes. Because of, you know, what data. I mean, the UK does have laws around right to access to birth parents, but they're quite strongly emphasised on on an adopted child being able to activate that process if they choose, rather than it being the other way around, where the parent has got the same legal rights to find the child. So yeah, it's a lot of challenges. That was a major issue, and it's not really. It's sometimes there for men using Housing First, but not to the same extent, I don't think.
Well, thanks for that. I'm conscious we're now at 11, so I've kept people. So thanks to those of you who've hung in with us for the extra couple of minutes. We will circulate the recording of this presentation. I think it's something I'll certainly be going back to. I think there's a huge amount in this and a huge amount to go forward with. Again, thank you all. If you'd like to be on our subscription list for future Simon Talks, do email my colleague Anna Marie at burke.burke@simoncommunity.com, and she will add you to the list. And thanks again, and we'll finish up there.
Thanks.